Hello everybody. I'm really very disappointed to not be with you in person. I'm fairly new to my current role and was really looking forward to mingling with such a terrific mix of people, including some people that I haven't seen in many years. You know, obviously this has been a tailspin of a year for those of us working in environmental and public health, but I sense that we are transitioning from perhaps feeling overwhelmed to now mobilizing with strategic purpose and resourcefulness. As a former federal worker who used to be with the US EPA until May of this year, I certainly feel that way. And I could not be more thrilled and honored to be part of the California EPA family, where the lights are very much still on. And now let's turn to microplastics. In February 2022, the California Ocean Protection Council released an almost 40-page document called the Statewide Microplastic Strategy. This means California has a clear and public strategy for tackling microplastics by cutting plastic pollution and developing science-driven innovation to protect our land, water, and our health. The strategy document is a two-pronged approach: solutions that can be started now and research strategies to inform future actions. This plan pulled in one place for the first time actions spanning multiple state agencies to bring their expertise to bear on microplastic pollution, with large roles for those in the California EPA. For those of you who don't know, the California EPA is an umbrella environmental regulatory organization with boards, departments, and offices that each function as their own agency. I direct the Office of Health Hazard Assessment, or OEHA, which is the lead state agency for conducting health risk assessments of toxic chemicals. Before I talk about OEHA more, I want to briefly highlight activities by other Cal EPA agencies. The State Water Board completed method standardization for drinking water in 2022, and we now have 2 accredited labs in California. This is really important because now we can monitor levels and understand trends. Monitoring data for major public water systems in California should be forthcoming in the next year. This would be the first such data of its kind anywhere in the world. California is also exploring approaches to make consumer products safer by driving a move towards products that don't expose people to microplastics. To that end, the Department of Toxic Substances Control is proposing to add microplastics to the Safer Consumer Products Program. If enacted, the department could then work with the consumer products industry to begin identifying products that contain or cause significant exposures to microplastics and to study and select alternatives. Cal Recycle is also addressing microplastics through its overall efforts to reduce plastic pollution at the source, such as regulations to encourage shifts to plastic alternatives. Some of the most assertive targets are to reduce plastic pollution with goals to reduce single-use plastics by 25% by 2032, and to ensure the remaining plastic packages is 100% compostable or recyclable. Now, going back to OEHA, last year the governor signed legislation SB 1147 that directs us to study the health effects of microplastics in drinking water, including both tap and bottled water. Then, based on our findings, the State Water Board may direct us to develop a public health goal for microplastics in drinking water, which would be a major step towards setting regulatory limits. Our work will include a thorough review of the scientific literature on microplastics toxicity, how they transform and move through the body, and the relationship of exposure level and severity of the health effects. And I'm sure we will also identify data gaps. You know, OEHA has been assessing drinking water contaminants for almost 30 years, including assessments of hexavalent chromium, arsenic, perchlorate. But our work on microplastics is different since they're not one substance. There are thousands of types, different shapes, sizes, polymers, densities, additives, and chemical hitchhikers. Therefore, traditional methods don't fit, and we need to find a different science framework. California has and will continue to be a thought leader in this space. We are just not starting on this work now. You know, OEHA dove into the health effects literature in 2020 to 2021, and we worked with an international group of experts to evaluate the studies available at that time. About 70 studies were looked at, but many were not the type typically used to set a public health goal. For example, many studies were conducted in cell or tissue-based in vitro models, which are hard to extrapolate to humans. especially for an exposure as complex as microplastics. About 10% of the studies were considered more useful to derive a public health goal. These studies pointed toward effects on reproduction, inflammation pathways, effects on the liver, gut, thyroid, and heart tissues. However, most of these studies use polystyrene microplastics, which don't match the complexity of what humans are exposed to. Any additional effects of additives would be missed, as well as pathogens. Microplastics can be vectors for bacteria and viruses. The experts felt the science at that time wasn't ready for regulation. The data was limited, exposures too uncertain. But the research on microplastics is exploding. It's more than quadrupled since our last analysis, and we estimate there are about 6 new publications each day. So under SB 1147, OEHA will be taking another look at the evidence, reevaluating every study, coordinating globally, and building the next generation of risk assessment tools. We're also building open source tools so anybody can access the same information. We're in the early stages of implementing SB 1147. We anticipate the first update report, not the final, to be published no earlier than late 2026. And we invite you to follow along, because by uncovering how microplastics affect our health, we're not just advancing science, but we're laying the foundation for consumer and business education and science-based decision-making. So thanks for your attention. I hope this gives you a better idea of what California is doing, and please feel free to reach out if you have any questions.